Okay, so have you ever caught yourself looking in the mirror like, wait, is it just me? Or is one eye doing its own thing?
Because if so, oh my gosh, this deep dive is for you.
We are tackling a question that we got from a listener all about asymmetrical eyes.
And they were amazing. They sent over a bunch of articles, research, even like personal notes, and
Well,
we are here to like unpack it all.
Because, yeah, faces aren't like perfectly symmetrical, but eyes, those feel kind of important.
Right.
So joining us is our expert, here to bring all that medical knowledge.
And help us, sort the myths from the, well, eye-opening truth.
Happy to be here. And I can already tell, this listener is not alone. Asymmetrical eyes are so common.
Really?
It's almost weird to find someone whose eyes are, like, perfectly matched. Genetics are a huge part of it, just these teeny variations in how our faces develop.
Which actually, now that you mention it, the listener did say some family members have similar features.
It is wild how often you notice it. Even, like, celebrities, they've got those supposedly perfect faces.
Right, exactly.
And you still catch those little asymmetries.
And it just shows you that those little flaws, quote unquote, are often what make a face interesting. Now, don't get me wrong.
Okay.
A little asymmetry is usually just part of being human.
But there are times when it could be a sign that you want to get things checked out, medically speaking.
Okay, so good to know there's like a line there.
Right.
When should we be like picking up the phone, making that doctor's appointment?
What are the red flags?
So looking at what the listener sent over, anytime you have sudden changes in your eyes.
That's worth a call to the doctor. Like, if you're experiencing pain, swelling, that weird pulsing feeling.
Don't ignore those.
Yeah, those are not things to mess around with.
Exactly. Your body's trying to tell you something.
It's like, hey, pay attention to this.
Precisely. And this might seem obvious, but any changes after an injury, especially to your head or face,
Go straight to the doctor.
immediately.
Yeah, much better to be safe than sorry, especially when it comes to your vision. But, okay, let's say everything's fine, medically speaking.
Okay.
Our listener was also really curious about those cosmetic fixes. And let's be honest, I think a lot of us have probably wondered about these
Oh, absolutely.
at some point or another.
And it seems like a good amount of what the listener sent was about these different options. And it's important to keep in mind, if your asymmetry is benign, it doesn't bother you. Treatment is totally, totally optional.
It's your choice.
Okay. But if it does bother you,
There are a lot of choices out there. Like, we're talking simple tweaks all the way to, like, full-on surgery.
it's like, where do you even start?
Well, a lot of people start with something they probably already have in their bathroom, makeup. It's the most accessible, least invasive way to play around with symmetry, create an illusion.
Oh, for sure. And the listener actually mentioned like contouring and highlighting,
Yeah,
which I'll be honest, I'm more of a like chapstick is blush kind of person.
sure.
But I get the idea, BAT. Then there's this whole eyelid tape thing. That, to me, that's next level.
It's more common than you think, honestly.
Is it really?
It's these little, like, almost invisible, transparent strips you put on your eyelid.
Okay.
And they just give this really subtle lift,
Oh, interesting.
which can make the eye look more open, more even with the other.
So you're like literally sticking your way to symmetry.
Pretty much.
That's wild. See, this is why I love deep dives. You learn something new every time.
Okay, but let's say somebody wants to go a little beyond makeup, something a little more, I don't know, like more permanent-ish.
Right, you're talking about like more medical options then.
Yeah.
And one that's become really popular for asymmetry is Botox.
Wait, really? Botox? I always thought that was like a wrinkle thing, like for your forehead,
It was great for wrinkles, don't get me wrong.
But it's actually really versatile. Think of it this way. Sometimes that asymmetry is because one eyebrow is just sitting a little lower than the other.
Okay.
And a tiny bit of Botox in just the right spot, it can give it that little lift and even things out.
So it's not like changing your whole face, it's like micro adjustments.
Exactly. Very, very
And
precise.
subtle difference.
And the nice thing is, because it's so targeted, there's less downtime than like a full surgery.
Gotcha. So you're not going to get that like, whoa, what did you have done look?
Right.
It's more like, oh, did you get a haircut? You look refreshed.
Exactly. Subtle.
Sneaky and de-effective. I like it. But it's not like forever, right? Botox.
Right. It's not a permanent thing.
Because what happens is your body actually breaks down that botulinum toxin over time. So usually lasts like 3 to 6 months, something like that.
So it's like your face slowly unbotoxes itself.
Yeah, pretty much.
Back to normal.
Oh.
Okay, good to know. Good to know it's not like a one-way street.
And of course, big disclaimer, everyone listening, nobody go injecting themselves at home after this, okay?
Oh my gosh, please no.
Always, always, always consult a qualified medical professional for this kind of stuff.
Absolutely.
For those people who are looking for like a longer lasting result, there's always the brow lift.
We're getting more serious now.
Right. Brow lift. I'm not going to lie, that sounds kind of intense. Like you're surgically like hoisting your eyebrows higher.
It does sound more dramatic than it actually is.
Yeah.
Essentially, the surgeon makes incisions, usually hidden along your hairline so you can't even see them.
Okay.
And then they lift and reposition the forehead tissue, and the eyebrows come along for the ride.
So you're literally pulling things back up where they belong.
Pretty much.
That's wild. But doesn't everyone's face like have a different structure? You know what I mean?
Oh, absolutely. And that's why there are actually multiple techniques for a brow lift.
Oh, interesting.
A skilled surgeon will like assess your anatomy, what you're hoping to achieve, and tailor it.
So it's not like a one-size-fits-all up there situation.
Yes, exactly.
Okay, so get this. This is wild. The listener's notes mentioned another option, and I never would have guessed this in a million years. Eye drops.
Eye drops.
Eye drops.
I know, right?
You wouldn't think eye drops could do anything for, like, asymmetrical eyes.
Right.
But there's a specific type. It's a prescription one called Upneek.
Upneek, yeah.
And it's FDA approved for something called acquired blepharoptosis.
That's a mouthful.
Hold up. Acquired blepharoptosis in English, please.
Sorry. Basically, it just means a droopy eyelid that develops, like, over time.
Okay.
So if part of your asymmetry is because one eyelid is just hanging a little lower than the other, Upneek can actually help lift that.
So it's not for all kinds of asymmetry, but if droopy eyelids are part of it, these drops could be, like, a game changer.
Exactly. It's targeting that very specific thing.
Gotcha.
But like we were talking about with Botox, it's not permanent. The effects do wear off.
Okay, so it's giving your eyelid a little bit of a boost, but not like a whole,
Not a complete overhaul.
Not a complete overhaul. It's drop test, not, magic potion. Ha.
Right, exactly.
Okay, so we've covered makeup tricks. We've talked about Botox tweaks, brow lifts. We've even got specialized eye drops in the mix. But what about actual surgery on the eyelids themselves?
Now we're talking blepharoplasty.
Yes, blepharoplasty.
And that's where things get, definitely a step up in terms of like involvement. It's a surgical procedure.
Right, which some people might actually be more familiar with,
Like I feel like I've heard of blepharoplasty in the context of like under eye bags and that kind of thing.
Oh, absolutely. Yeah, a lot of people get it for that.
Blepharoplasty can address a lot of concerns, but it's important to remember this IS surgery.
Right.
So it comes with all the usual considerations, risks, recovery time, all of that.
Right. Definitely not something to jump into lightly.
No.
So when is blepharoplasty like the way to go for asymmetry? And are there like even more intense surgical options than that out there?
So blepharoplasty, it's usually considered when you've got like excess skin
Okay.
deposits, or if the eyelid is drooping so much that it's really affecting the shape of the eye itself.
Gotcha.
It's also a good option if the asymmetry is being caused by something that those less invasive things just can't fix.
So it's about like changing the actual structure, not just the like surface appearance.
Exactly. You want to address what's underneath. Now, you did mention even more intense surgical options.
Yeah.
And there is one we haven't talked about yet, orbital surgery.
Okay, yeah. That one sounds like, bringing in the big guns.
We're talking about the actual eye socket now, right?
Yeah, you got it. This is for the most complex cases, like when the asymmetry is actually because of the bones around your eye.
Wow.
Think like trauma to the area, maybe something someone's had since birth, or in some cases even tumors, things like that.
So yeah, definitely not your average, oh, my eyes are a little uneven situation. This is serious stuff.
Exactly. It's about correcting the structure that's affecting the position of the eye itself.
Wow. Okay, so big takeaway here for everybody when it comes to asymmetrical eyes. There's a huge spectrum of approaches. Like we're talking tiny tweaks all the way to major surgery, depending on the root cause.
Right. It's not one size fits all.
Not at all. And that actually makes me think about something else the listener mentioned, which is those underlying medical conditions. Because sometimes uneven eyes, they're not a cosmetic thing.
Really important point.
It can be a sign of something else going on in your body.
Absolutely. And we've been talking a lot about these cosmetic fixes and they're great.
Yeah.
But that asymmetry can be a clue, like your body's trying to tell you something's up. The listener was smart to include all that research on potential medical causes.
And it's important to say this isn't an exhaustive list, right? Medicine's complicated.
Right, it's more like a, hey, this stuff exists, so if you are concerned, talk to your doctor.
Exactly. This is a conversation starter, not the final word.
Yes,
Yeah.
100%. The key takeaway is this. If you've got asymmetry and other symptoms going on, especially pain, changes in your vision, things like that, get it checked out.
They don't wait.
Don't wait. It's all about like listening to your body, trusting your gut.
Your body knows best.
It really does.
Yeah.
Speaking of things that sound kind of intimidating, the listener's research mentioned something called silent sinus syndrome.
Oh, yeah.
And I'm not going to lie, that name,
A little ominous.
not the most F-U-N.
It does sound scary, right?
Uh-huh.
But it's usually way less dramatic than the name makes it seem.
Yeah.
What happens is, one of the sinus cavities, it actually shrinks.
What? Really?
And that can then affect the EYE socket on that side of your face, which can cause the asymmetry.
Huh. So it's like a chain reaction.
Exactly.
Yeah.
And people with this, they often have like chronic sinus pressure too.
Interesting. So that's like another thing to keep in mind if you are someone who's prone to sinus issues in general.
Definitely. Could be connected.
Okay. The listener also specifically asked about Bell's palsy,
Yes,
which I know can also cause facial asymmetry.
it can. Bell's palsy, it basically weakens or paralyzes temporarily the muscles on one side of your face.
Okay.
And because of that, you get this drooping, and that can include the eyelid, which makes the eyes look uneven.
So it's like your face is like suddenly decided to do its own thing on one side.
Yeah, which understandably would be really strange to experience.
Very weird. But the good news is it's usually temporary, right?
In most cases, yes. It tends to resolve on its own, and there are medications, therapies that can help the process along.
That's reassuring. Oh my gosh, we have covered MUCH in this deep dive.
I know, right? It's amazing how much there is to say about asymmetrical eyes.
It's wild. We've gone from like genetics to makeup tricks, Botox, even like orbital surgery. There's a lot to think about.
It really highlights how what seems like a simple thing, like, oh, my eyes are different, can actually be this window into so many different things. Anatomy, genetics, even just like personal choice and how we see ourselves.
I love that. And hopefully our listener is feeling, number one, way more informed,
Yes, knowledge is power.
and maybe even a little empowered too. Because what we've learned is asymmetry, it's incredibly common. There is no need to try to fit some like unrealistic standard of perfect eyes.
Forget those standards.
Forget them. But if it is something that bothers someone, they've got options. They don't have to just live with it,
Exactly. It's all about you feeling confident and comfortable in your own skin,
Mm.
or I guess in this case, your own eye shape.
I love that. Perfectly said.
Yeah.
And on that note, huge thank you to our listener for honestly this fantastic deep dive question.
It was a good one.
It was so good. And to everybody listening, keep those curious questions coming. We love exploring this stuff with you. We'll be back next time with another deep dive.
See you then.
But until then, stay curious out there.